you very much for giving me the opportunity to present the results that we gathered in our studies within the last few years. And it's very interesting for me as a clinician to see the different points of view that we gather as clinicians, and that on the other hand are pointed out by engineers. And I especially want to thank Ralf Krüger, who is a co-worker of ANSYS Germany, who supported us with the boundary conditions and especially in generating the models. Nasal climatization is a very complex function, and it's dependent on several functions, several factors. Oh, just seeing that the video doesn't work. Sorry, it's not that important. Having a look at the human respiratory tract, it is a complicated area, and especially the nasal cavity, the first part which comes in contact with the inspired air, is is built in a very complicated way. At first sight, there are many narrow spaces. There are the nasal turbinates. Obviously, none of the videos does work.
You have to press on it because
no, it doesn't work either. Don't worry. It's not that important at that point. Okay. Well, basically, it's just a small endoscopic video. I hope it will work later on. Well, we have a lot of narrow spaces. We have the turbinates that at first sight are an obstacle in the nasal streaming area, and a lot of mucosa. But these narrow spaces, or these three factors, are the main reasons why the humidification, warming, and cleaning process is realizable, and these three factors grant for a perfect gas exchange within the human lung. Professor Mlinsky and colleagues, they published numerous papers about the nasal streaming system, and they started with silicon models that they generated from human specimen cadavers, and they generated the displayed models that were filled with fluid and that were streamed, and they could show that the physiological stenosis of the nasal entrance has a very good or has the function to distribute all of the inspired air along the whole nasal cavity. We started with in vivo measurements because this still is the basis for gathering data regarding the nasal cavity. We have the advantage of getting real data. It's performable easy and quickly. The disadvantages are that we only can see data from single spots, that we can't display whole areas or three-dimensional spaces, and we always have cables that are right in the middle of the streaming lines, so they influence the results. Anyway, our working group tried to realize a mapping of the human nose, and we gathered data regarding temperature and humidity values of key areas in the human nose. That's the nasal vestibule, the valve area, anterior turbinate area, and the nasopharynx. And these temperature profiles that we gathered from about 60 individuals were then used as a base for the boundary conditions for our presented computational fluid dynamics. So we changed from the in vivo measurements to visual virtual models that were able to display airflow, temperature, and humidity in just one run. And this was realized by computational fluid dynamics, and we used ANSYS Fluent. So Fluent from ANSYS Workbench. This is one of our first studies that we performed. It was a CT scan of a 40-year-old male with approximately symmetric anatomic conditions. And we generated this grid model, and also we used a spherical structure as a velocity inlet around the nose, because we think that the turbulences or the streamlines around the nasal vestibules is displayed more correctly in that area. We chose coronal slices to display the results. because we as ENT surgeons are used to CT scans. The nasal airflow, the main part of the nasal airflow, as is seen here, takes place around the upper part of the inferior turbinate and around the middle turbinate. This higher resolution model shows the effect of the nasal valve area that distributes the streamlines all around the nasal cavity. And for our temperature and humidity research, we used the following graphics that show the pressure relations between in and expiration at the left and right nostril, as well as the trachea. Our breathing cycle had a length of, or was defined to have 14.3 gasps per minute. Inspiration lasted about 1.9 seconds, expiration 2.3 seconds. Inspired air was defined at 20 degrees Celsius and 30% relative humidity. And we had a dynamic temperature at the mucosal wall that was at the beginning of inspiration 34 degrees and went down to 30 degrees at the end of inspiration, and the other way around during expiration. Assuming a constant moisture film, we defined constant humidity content of 100% relative humidity at the wall. Sure. Is it possible to just open it without the reference? Because we tried it at the other one.
So, do you remember your?
Yeah, it's. Is it? Where is it? That one?
Yeah.
Can I just open it with PowerPoint directly?
Yep.
Oh, it works.
See.
No, it doesn't work right here. Well, I'm trying to describe what the videos should show. We just tested it before it worked there, so we don't know exactly what the problem is. Oh, I don't have the adapter with me, so. So basically, this is a short video that that shows the temperature distribution during in and expiration. And what we can see is that the temperature, the main airstream, and the temperature decrease is located around the middle turbinate and the nasal entrance, and is visible at the end. Having a look at the coronal slices at the very beginning of the breathing cycle, we see that in a very quiet breathing, we reach up to 33 degrees temperature in the nasopharynx in a normal breathing. And at maximum inspiration, in a quiet breathing cycle, we still reach about 28 to 29 degrees Celsius. Yeah. Shall I just put it down, or? No, there's a picture, I think. Okay. Yeah. I just put it on here. Okay, so this is the temperature distribution during in and expiration that I just pointed out. The coronal slices I already showed to you. Regarding the humidity content, it looks very similar. And what was interesting for us to see is that especially the first third of the human nose is the main factor that is responsible for for a perfect distribution in the functional area of the posterior part of the nose. And the humidity values, similar to the temperature, in a beginning of the breathing cycle, we reach up to 98% of humidity in the nasopharynx, and during maximum inspiration, we still reach up to 94 to 96%. So, summing these results up, we have in a short distance of about 7 centimeters a temperature increase of about 9 degrees and increase of the humidity content of up to 66% just in the human nose. And obviously this physiological stenosis and these narrow areas in the human nose are there on purpose, and especially the nasal valve area, and the inferior turbinate is part of this stenotic area, acts as a diffuser, which is very, very important for the climatization process. We then used these results for having a look at empty nose syndrome. I know that we have a talk later on about empty nose syndrome, so I don't want to go into detail too much, but just want to point out the differences regarding temperature. If we have a look at the nasal cavity on the right side, it is clearly visible that the temperature is much lower if the turbinates are just cut out. This was a patient that I operated on a few weeks ago, and no worries, I didn't cut out the turbinate. I did a septoplasty revision, but I discovered that this patient obviously has had a turbinate. It's not a turbinoplasty, it's basically a subtotal turbinate resection, and just the posterior parts still are in place. And this patient still had problems, and the problem was mainly located at the septum and not at the nasal turbinate. So what happens in patients like that? We create a tunnel-like structure in the lower part of the nose, and of course the nasal volume is increased and there is a higher airflow in that area. But in the posterior parts of the nose, we have a definitely increased speed airflow, and we have a decreased temperature and a decreased relative humidity in that area. And as we just talked about previously, nasal patients is a subjective factor, and it's not always comparable with maximum airflow. Another patient that we had in our studies was a 45-year-old patient who suffered from impaired nasal breathing. He underwent turbinoplasty. We used piriform turbinoplasty, which is a very decent method to operate on the patient without resecting too much mucosa. And we were lucky because we had an imaging before and after surgery, and we just have a look at the posterior parts. This is the preoperative result and the postoperative result, and the relative humidity contents. And if we consider that it's a very, very cautious way to operate on the patient that just lateralizes the inferior turbinate, we still have an effect in a decreased humidity content in the postoperative area. This patient was free of complaints afterwards. He definitely had enough nasal breathing, but also a very decent or a very, very cautious way to operate on him is has effects in the posterior parts of the nose. So a partial turbinectomy and even a turbinoplasty has an increased flow rate as a result. Nasal volume is increased, the mucosal surface is decreased, and the contact time between air and mucosa is decreased significantly. Any alteration of the nasal valve has, as a result, an impairment of physiological flow and climatization process and should be done very cautious. The last part, so we had temperature and humidity content. I'd like to point out some results regarding olfactory fossa and olfaction. It's a very narrow area located medial to the middle turbinate up at the roof of the nasal cavity. And there was an interesting study that was published in the beginning of this year in rhinology, and these colleagues, they investigated the effect of location of nasal polyps on olfaction in different patients, and they stated that the right upper model, the pre-olfactory type, has the most significant influence in the perception of olfaction. So I think this is a logical result, but they had really nice pictures that demonstrated that very, very good, that there is not many particles passing the olfactory fossa. We just created a nasal model and defined massless particles in a normal inspiratory flow. And what we can see is that in the region of interest, in the upper area, there is just a few particles passing up there, and we seem to have any vortice, quite amount of vortices and very slow airflow that there is no, it seems like no laminar airflow in this area, and just a few particles that find their way up to the olfactory fossa. Another interesting study from 2008 showed the results after investigating 75 subjects in hypo and hyperbaric conditions at different humidity levels. And these colleagues stated that water molecules support the interaction between odorants and receptors of the olfactory mucosa, and an increase of environmental humidity obviously increases the capacity of air to carry odorants. So obviously we have a slow airflow which seems to be turbulent in the olfactory fossa, and just a few particles that are enough if the boundary conditions are correct that grant for a good olfactory reception and that allow the particles to dock at the cilia of the olfactory fibers. And mainly airflow is responsible for the olfactory perception. Temperature and humidity are relevant factors as well. And I'd like to conclude with this painting that Professor Mlinsky demonstrated in one of his earlier talks. He divided the nasal cavity in two different areas, and one area of inflow and the other is the functional area. And he stated that any manipulation in the inflow area will have serious consequences for the functional area. So basically, surgery should be done in a very careful way. We have a very high climatization potential of the nose. Airflow defines the mucosal contact time. Humidity and temperature depend on each other. The narrow spaces are very important for a correct climatization process. And as I just said, any surgery that is done regarding the nasal turbinates should be done in a very cautious way. Thank you very much for your attention.